ஒரு வினாடியோ ஒரு நிமிஷமோ நமக்கு ஏற்படுற ஒரு பிரக்கண போறது, அதாவது சுயநினைவு இல்லாமல் இருக்கிறதுக்கு வலிப்பு நோய் அப்படின்னு சொல்றாங்க. அப்ப சில பேருக்கு கை வெட்டும், கை வெட்டாமலும் வலிப்பு நோய் வரலாம், கால் கை வெட்டு வராமலும் வலிப்பு நோய் வரலாம். இன்ஃபேக்ட் வந்து பார்க்கறதுக்கு அகோரமா இருக்குல்ல, கால் கை வெட்டுறதுன்னு சொல்ற அந்த காக்கா வலிப்பு, அது வந்து ஈஸி டு ட்ரீட். ஆக்சுவலா அது மாத்திரை போட ஈஸியா கண்ட்ரோல் ஆயிடும் 1 yearல.
ஆல்சோ அந்த டைப் கொஞ்சம் கம்மி. ஆக்சுவலி காம்ப்ளெக்ஸ் பார்ஷியல் சீஜர்ன்ற டைப் வந்து மோர் common than on the general kind of fit. In the Punnodia fits, for instance, initially she used to just get eye blinks like that, she'll blank out for a little while and then she'll be back. But many times, then during some of those blank outs, she'll fall backwards. So you can imagine the risk of injury, the inability to study, and she's a young girl, and now I am very happy to say that we have come to 2 tablets. Tomorrow we have to think of her marriage, her having a child, all of that. So we've been, and the type of epilepsy also is important to know whether it will respond to drugs or not. If an absent seizure type will actually improve as the child grows up. So we are lucky that she has that category of seizure also. So that also is assisting the process, not just that I've done a great job and brought from 8 drugs to 2 drugs.
நம்ம ஊர்ல வந்து காமனா ஃபிட்ஸ்க்கு வந்து நிறுத்துங்கன்னு வர்றது வந்து ஒரு குரூப் தான் நான் பார்த்தது. என்னன்னா வந்து அந்த மேரேஜுக்காக வெயிட்டிங்ல இருக்காங்க கேர்ள்ஸ் மெயினா. அவங்க தான் வந்து எனக்கு வலிப்பு எப்படியாவது நிறுத்துங்க, நான் கல்யாணத்துக்கு முன்னாடி வலிப்பு இல்லாம போய் கல்யாணம் பண்ணிக்கணும் அப்படின்னு மாமியாரோட தெரியாம பண்ணோம். அந்த ஒரு ஸ்மால் குரூப், அட்லீஸ்ட் எங்க சீரீஸ்ல வந்து 15 பேஷண்ட்ஸ் பண்ணியிருக்கோம். அது வலிப்பை நிறுத்திடுறோம் கம்ப்ளீட்டா, so that they can get pregnant, get married and their normal life. So அதுதான் வந்து சோஷியல் ஸ்டிக்மா வந்து ஒரு மோட்டிவேட்டிங் ஃபேக்டராக நம்ம நெகட்டிவா பாசிட்டிவா எடுத்துக்க வேண்டியதுதான்.
In fact, one of our patients was divorced, and then the brother said after a few years he brought her and said, you do epilepsy surgery, I'm going to get her remarried because I want her to have a good life. You remember Gomu? So that also is one of the ways with which epilepsy surgery can be used.
Surgery itself is minimally invasive.
Do you identify any scar?
He's had surgery.
He had a surgery done 1 year ago. You said you were done surgery. I also don't know. I have to look at it. You don't see any scars. And this is the left side. This is the place where we do operation. This is our non-operator side, and this is the operator side. I don't see any scar. That is the way. You can carefully, if you notice, this side slightly deeper. That's only if you carefully notice. Sorry, it's not disfigurement. He himself says it's not disfiguring.
No, but I think you asked from a different point of view than minimally invasive surgery. This is a regular right proper brain surgery. It is not the minimally invasive category where you just put a tube or an endoscope and do something and come out. So it doesn't fall into that category. It's an open surgery. And the operating wand and the navigation system and microvascular technique and excellent microscopy when we were all that we've got the infrastructure which makes it more accurate, very targeted. So you can just exactly, so normal tissue is minimally or never taken out, only the scar tissue is taken out. And like the person who promotes epilepsy surgery in developing countries says, no brain is better than bad brain. So that's the philosophy of that part of it. The scarred brain is better out. And I tell the patients that it is like a naughty child in a class of good children. Not only does he misbehave, it disrupts the whole class also. So this, not only does this give abnormal discharges, it keeps on disturbing the entire brain function. And if it is left long enough, it can get a mirror image focus on the opposite hemisphere. So actually you are propagating the epilepsy and increasing the extent of the scarring of the brain or the abnormalities in the brain. So these are all reasons why the difficult to treat epilepsy clinic is even an important concept. Is we want people to realize this and send the patient in good time so that you can get good outcome. Because you send a person who's had 40 fits per month after 30 years, the chance, we've been lucky, we've had some patients like that, but they've done fairly well. But you can't always be lucky and you won't get your best result. And this fear is actually more in children. Children actually, when you refer early and do surgery early, you give them a whole lease of life. And so it's important for people to understand that referral has to be done at an optimum time of at least 2 to 3 years when you know that drugs are not working, maximum. Yes, lifestyle modifications are a very, very important part of epilepsy treatment. The most important lifestyle modification is to avoid sleep deprivation. Because sleep deprivation is a consistent trigger of seizures. So they have to get at least 6 to 8 hours of sleep every night. The second thing is prolonged television viewing, prolonged video viewing. Now everybody is crazy about computers. So they play video games, flashing lights. In photosensitive epilepsy of a certain variety, the flashing video games and that can induce a seizure. So one needs to be careful. Then treat a fever promptly. Be careful what drugs are given, certain antibiotics and some cold medicines. The commercial cold medicines can trigger fits. And undue emotional stress. And one of the important emotional stresses patients have is, will I get a seizure? Why are my seizures not better? Why am I different from everybody else? This itself can perpetuate. You can make yourself have more fits by just going on feeling bad. So improving the attitude of the patient is very important. And long ago, when we used to have Sinduri as a disco place and a hotel, I used to very often be in the emergency in Apollo on Sunday mornings. Because the combination of people with seizures, young people, not eating properly, so if you miss meals also you can get seizures. So not eating properly, having a late night, missing sleep, disco flashing lights, the whole combination, and they'll miss their tablet because they've not eaten their dinner, or they'll be eating some snack or something, and Sunday morning they'll be in Apollo emergency with seizures, ruining my Sunday as well. But that will highlight to you the combination of factors which can act as triggers.
Somebody asked what is the success rate for epilepsy surgery. Yeah. Success rate அப்படிங்கிறது பார்த்தீங்கன்னா there is no risk to life, 100% safe for the life. Seizure control அப்படின்னு சொல்றோம், seizure freedom. அது வந்து 80 to 90% வந்து கம்ப்ளீட்டாக ஃபிட்ஸை நிறுத்தத்துக்கான வாய்ப்பு இருக்கு. அந்த 10% to 15% வந்து ஆப்ரேஷனுக்கு முன்னாடி ஒரு 40 டைம்ஸ் ஃபிட்ஸ் வந்தது அப்படின்னா ஆப்ரேஷனுக்கு அப்புறம் ஒரு 5 டைம்ஸ் இல்லை 6 டைம்ஸ் வரலாம். ஒரு 1 to 5% ஆஃப் பேஷண்ட்ஸ்க்கு நாங்கள் வந்து ஃபெயிலியர் அப்படின்னு சொல்கிறோம். அந்த ஃபெயிலியர் தான் என்ன அர்த்தம்னா அவங்களுக்கு வந்து ஆப்ரேஷனுக்கு முன்னாடிக்கும் பின்னாடிக்கும் சர்ஜரியில் வந்து ஃபிட்ஸோடைய நம்பரில் வந்து ஒன்றும் வித்தியாசம் இல்லை அப்படின்னு சொல்கிறோம். ஸோ ஓவரால் சக்ஸஸ் ரேட்னா ஐ வுட் சே அரௌண்ட் 80% சீஷர் க்யூர். இப்போ மெடிசன்ஸ் லைஃப் லாங் நீங்கள் எடுத்தால் கூட சீஷர் க்யூர் அப்படிங்கிறது ப்ராமிஸ் வராது, நீங்கள் மாத்திரை ஆயுஸ்ஃபுல்லாக எடுத்துகிட்டு இருக்கணுங்கிற மாதிரி. அதாவது சர்ஜரியில் வந்து சீஷர் க்யூர் இஸ் பாசிபிள். So they can get a license if they want, they can get married and pregnant. These three things with social factors and get employed usefully.
But some patients may not be able to stop medicines completely. We may be, in a lot of them we are able to stop in 1 to 2 years. But some patients may need a small dose of drug to be continued longer. But the advantage is they were on 5 drugs with side effects and having seizures. Now they have no seizures and they may just need a maintenance tablet. So that is a small percentage. So that will be the outcome of surgery if you want.
So technically in epilepsy the etiology is not that important.
For epilepsy surgery, if we have scar tissue, if we have a structural change, it makes it more amenable to surgery and gives us a better outcome. And there are a group of patients, we have not talked about an operation called hemispherectomy, where in childhood the brain is damaged considerably and almost half the brain has got scar tissue and it's producing terrible fits. So we can remove almost all that scar tissue away. That it's half the brain, hemispherectomy. But we leave behind a nubbin of tissue near the center which helps the communication between the two. And already the person would probably have a hemiplegia or weakness of one half of the body in such case. So it's not going to make the paralysis worse. but the fits will stop and completely transforms the quality of life. We have had how many cases in hysterectomy? About 8 or 10 cases. So they've done very well.
Etiology can be different, as you rightly asked. The commonest etiology I said is the complicated febrile fits. அதாவது 5 வயதுக்குள்ளார ஏற்படுற ஒரு febrile fitsல complicated febrile fits, அதாவது prolonged febrile fits. அதுதான் வந்து commonest எங்களுடைய etiology. Other etiology வந்து சின்ன சின்ன டியூமர். Third வந்து previous head injury. And the fourth etiology virus encephalitis. So these are the 3-4 causes for intractable epilepsy.
Thank you everybody. We thank all the media fraternity from Chennai to take out their time and join us to launch this difficult to treat epilepsy clinic. We have a small announcement to make.